Welcome to the WRAL Daily Download. I'm Jack Hagel. You can now find mental health care in more North Carolina schools. That's because schools are hiring outside agencies to provide services for kids who can't otherwise leave school to get them. Providers and educators say the services are improving kids' moods and helping them focus on school. WRAL Education Insider Emily Walkenhorst dug deep into the issue, and she joins us now. Emily, welcome back.
Of course, glad to be here.
Mental health has been worsening for young people in North Carolina for years. Why is that?
Right. So, and it's also important to remember this is not really unique to North Carolina. We have a lot of theories. People point to the advent of smartphones. They came out in 2007, became more ubiquitous a few years after that. And then you kind of started seeing a tumble, especially for young people, but maybe also for some younger adults. And, the thinking is, well, maybe they, this is just a bad feedback loop that they get in if they're always connected to social media. That's one very popular theory that is probably just gaining more and more traction every day. But, they also just don't completely know, why things are so much worse. Is it, does this have to do with something that is, trending among parents, maybe something parents aren't doing that they used to do, or something that they are doing now that they didn't used to do before. I mean, any number of things, lots of theories out there.
And on a recent episode, we talked about this risk survey, this federal survey of students. What did that tell us?
Right. So we had a federal survey, the Youth Risk Behavior Survey, and that really just kind of reflected some of the trends that since 2013 was, I believe, the recent year that we compared to. Things are worse. More kids are reporting feeling sad, having suicidal thoughts, things like that. And things kind of just kept getting worse and kind of peaked during, the 2021 survey, which would have been right in the middle of the COVID-19 pandemic. And school closures and things like that. And then in 2023, things actually got a little better. They didn't bounce back to the 2013 levels, but, certainly kids had experienced some kind of a relief, being back among classmates. Maybe they're not feeling as lonely anymore because they're able to see kids in person. And so we did see some metrics improve, and we'll have to keep an eye on those in future surveys.
So it makes sense then that mental health agencies are helping bring care to students in schools. How does this work?
Right. So, school-based mental health, can mean a lot of things, but one common thing that it means is essentially kind of these outside contracts, any type of mental health care that is taking place at a school. And so a lot of schools, they do these memoranda of understanding or contracts with a third party. The school system often doesn't pay a dime for them. They just sign these agreements. So we don't need public funding for them necessarily unless the child is on Medicaid. Then obviously Medicaid would cover the services. Essentially, these providers come into a school and, if they see kids. So if the school and the parents always have to agree to it. If the parents say, hey, this child needs help, then the provider can come give that help to the kid at school. And, the thinking being that makes it so much easier for this child to get these services because maybe the parent just doesn't have time, 8 a.m. to 5 p.m. to pick the kid up in the middle of the day and take them to a session somewhere.
What kinds of services are they providing?
So kind of just your traditional talk therapy for the most part.
And are they seeing results?
So we kind of really just have anecdotes from people, hey, you're a school counselor, that, some of the kids who used to see you when they were in a crisis are now going to these therapists. What are you hearing anything from these kids? I mean, are they happier? And anecdotally, we hear that, some of them are. We also hear that this is not a process that results in big changes overnight necessarily. It might take months for some kids to have a breakthrough, just like it would for adults. But we do hear, at the beginning of the school year, this kid just didn't really smile a lot. That's what I heard from one social worker or one counselor. And she said, by the end of the year, she was smiling. She was outgoing. She was talking to people. And so anecdotally, you hear that it does make a difference for the child. And then for the school counselors themselves, they're not all licensed therapists or anything. You're not necessarily trained in some of these things. You can be as a school counselor, but you aren't necessarily trained to provide those services. So it allows you to kind of not feel like you're having to treat a child who has a more serious need that you're not prepared to provide. And so now you can pay attention to some of the other kids at the school who are maybe just having a temporary crisis, a temporary conflict with somebody or something like that.
Well, let's take a quick break. When we come back, we'll hear more about in-school mental health services for North Carolina students. Stick around. Welcome back to the WRAL Daily Download. We're talking with WRAL Education Insider Emily Walkenhorst about mental health services for North Carolina students. Emily, without in-school mental health services, what options do students have?
So there's kind of a mixture of options that are not really meant to be talk therapy. So you might have a school nurse, might end up being somebody a child goes to, or somebody who might observe behaviors and show, well, this child always comes in every day at 11 a.m. with a stomach ache every day. Maybe there's something going on here. Maybe a social worker who might be on campus to deal with maybe some, federal programs, things like that. Might be a person who could talk with a student. A counselor could maybe talk with a student, but they also have other duties. A school psychologist, that's someone who often is mostly there for special education programs, doing evaluations for IEPs, sitting in on IEP meetings. So there's not really a dedicated person who provides talk therapy of any kind on a campus. That's not really something schools are even really responsible for doing. There's no law that says you have to provide therapy for kids. That's not really the directive of public education. But obviously, it's something that these professionals in any of these capacities can see every day. This child needs help. This child needs somebody to talk to. So there are people who are kind of maybe there to deal with something that pops up today. Like this child is had an outburst in class today. Well, we send them to the counselor and we see if the counselor can try to figure out, how if they can calm down. But there's not really talk therapy at school unless you have, something like one of these contracts.
Now, one could argue that students have always needed mental health care. Why is this gaining traction now?
So, we're seeing these numbers rise. It's becoming something that's just a part of the everyday conversation in this country. We kind of have this burgeoning elementary understanding, but also interest in the field of mental health now, because we're seeing it in some of the people around us. Maybe it's our own child, maybe it's a friend or a parent or just somebody in our life is maybe struggling, and, we're just talking more about that as a society. Certainly the pandemic really accelerated a lot of that. So I would say that's maybe been the traction for some recent developments as we've seen, more kids and even adults reporting feeling suicidal or feeling lonely. There are professionals in these schools who are picking up on that, and they're moving forward with it. But I should also say that, this concept of having these partnerships is not new. So this is something that has been around, in North Carolina for years. In some places it is kind of new, but in some places they've had it for years and years and years. And even other states in this country, they've had it, for decades in a lot of these places. But certainly there's growing momentum for these programs, and it's a lot easier to work with insurance on this now, especially Medicaid. A lot more schools are accessing Medicaid to be able to pay for these services, because schools can be Medicaid providers now. So if a school, say, wanted to actually just hire somebody to be some, because a lot of these contracts, somebody's only there once or twice a week. Schools could actually just hire somebody in-house if they wanted somebody there 40 days a week, and now they can, be Medicaid providers and provide these services now. So
is that because of the recent Medicaid expansion in North Carolina?
No, that's something that's been around for a while, but certainly, there are more Medicaid dollars out there, and kids have been a little better covered for health insurance than adults over the years, but we know that a lot more schools are Medicaid providers now than they used to be.
Do you expect to see more services in more schools in the months and years ahead?
I do. So Wake County, our biggest school system, has these programs in dozens of their schools, but last I knew, it's not in every school. It's something that maybe used to be more common in some Wake County schools, and they're bringing it back kind of. So we know that there's interest in some of the biggest schools. Johnston County, it's in most of the schools there, but there are still a few schools left that can add it. That they're interested in adding it to. Now that schools themselves, can provide these services, they can be Medicaid providers. We have seen dollars rise in terms of the amount of money that's spent in schools on healthcare in general. So that's not necessarily just mental health, that can be physical health. And a lot of that actually benefits special education programs because those might be billable services for, a student's IEP, but it can also be mental health services or any just kind of health service for general students. And we've seen those numbers skyrocket. I mean, getting around $200 million in this state. Just to make sure that these services provided can actually be funded in some way. So, we know health-based clinics are increasing in the state. They're popping up in all corners. So we know that there's an interest in increasing access to services in schools, especially because it's not just helpful for the students themselves, it's helpful for the families. In a lot of cases, where you pop up with a clinic, maybe that's something that an adult can access sometimes as well. Or maybe what comes with that is a food pantry even. And there's this idea that if you can kind of create schools to be the central location for something, then you can draw families to it. They come to the school anyway for their kid, but maybe now they can access other things for their kid when they're at school too.
Well, it'll be interesting to see how these programs evolve and unfold. Thanks, Emily.
Of course.
That's WRAL Education Insider Emily Walkenhorst for her reporting on school-based mental health care. Go to the education section of WRAL.com. I'm Jack Hagel. Thanks for joining us, and thanks for listening to the WRAL Daily Download and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.